Hi, I'm Dr. Raymond Douglas of Beverly Hills, California, and today I wanted to spend a little extra time talking about the tolerability of Tepezza and especially the hearing side effects. And at first I wanted to speak a little bit about the overall tolerability of the medication, which by and large, most patients tolerate this medicine extremely well. In fact, my patients usually finish their therapy and really note very minimal or nuisance type side effects. However, there are some side effects that are much more concerning and do occur in some patients. And the one that really comes up a lot in our practice is hearing. So where does the hearing changes seem to occur? What was never noticed? Well, I did the phase 2 and phase 3 trials that were published in the New England Journal of Medicine. And in those trials, we did notice a couple patients who had hearing changes. They noticed either tinnitus or hearing plugging, and this was actually presented to the FDA. It didn't meet the criteria to put it on the label because not enough patients were affected, and this had never been seen before. And then the drug came out, and more patients complained about three things. They complain about ear plugging, or like you're underwater, you can't hear and it's muffled. They complained about tinnitus, or ringing in their ears. And then the third, some patients complained that they just couldn't hear as well or hear words as well. So I wanted to spend time on each of these three because we've spent a lot of time studying these individually. So most of the time, the symptoms of hearing changes occur not immediately, but usually after about infusion 3 to 4. And that's when the drug starts to build up. And sometimes when we start to see these symptoms, they first start as ear plugging or muffling, and then maybe later on it's kind of like a hearing decline. Either way, we've now noticed that we do audiology completely, for all patients throughout this time period. But even with ear plugging or tinnitus, almost 100% of that and those symptoms go away after discontinuation of treatment. The ear plugging is actually the eustachian tube and the fat pads shrinking around the eustachian tube, and that goes away typically 1 to 3 months after stopping treatment. We can sometimes pause treatment and allow that to go away also. Tinnitus is kind of the same thing. It is a little bit of a harbinger that we have to watch out for any other kind of hearing changes on audiology, but typically tinnitus goes away very reliably 1 to 3 months after stopping therapy. Now, the one that we watch out for are audiology changes or changes in high frequency hearing. And this is more when you're listening in a crowded room and you can't hear words, you don't hear the first start of words, things like that. And in these cases, the patients will often start to notice this maybe at infusion 3, 4, or beyond. And what we've found in audiology is if you have normal hearing, you're very unlikely to have any of these changes. They just typically don't occur in most patients who have normal hearing to start. So if your baseline hearing and your baseline audiology is okay, chances are you're not going to get that, but you could still get muffled hearing. That's going to go away after we stop. The second group of patients has underlying hearing changes. They may already have changes where they may need a hearing aid, or often they're a bit older, or they've been exposed to a lot of noises throughout their lifetime. And these patients, there is a significant percentage of these patients that do experience further decline. Now, the good thing is you can spot this. Most patients don't even notice that they've had further decline, but you can spot it and then either stop or pause the medication until it either resolves or not to restart it. I have a conversation with each patient and let them know that, hey, this is what's going on, and we may want to pause or stop the medication. And I think it's really important to have these upfront conversations because there's a lot of misinformation out there, and it's really good to rely upon the data and what we know. Now, what does all this mean for patients? Well, in general, Tepezza in about 90-95% of my patients really works incredibly well, and they're very happy that they took it. There are a minority of patients where they do have side effects, and that's where my job becomes important to monitor those side effects and help them through the side effects. And very importantly, to know that they occur and to potentially pause treatment. And that's something that we do also. So I hope that this helps to put things into perspective. We have other videos that actually show the data, and I'd encourage anyone who wants to read the article. It is available, and it is freely available in the journal Thyroid, that talks about very specifically the hearing changes. And it was the first article that ever had audiology that was measured before treatment and then all throughout treatment. And it's just one of the things that we want to do to make patients as safe as possible throughout their treatment and throughout their course of disease. So I hope that this was helpful.